Guys, tell me, when can we plan mock audit? Tomorrow is last session of our course. Actually, tomorrow we are going to discuss about KPIs and what we are supposed to maintain in that chapter and everything. But I need one more mock audit, and that will be a complete interactive session. I'll be the listener. You are the speakers, and we do have some mock audit. Come prepared. Let me know when can we have that and the time as well. Weekend, Saturday only, fine. Time, same time. You can unmute your PCs and you can talk. Can we plan at same time, 7 o'clock?
Yes, ma'am.
Okay. So how many people are working professionals here? Who is working for healthcare? Hospitals?
Ma'am, I am a clinical pharmacist.
Oh, nice. And more?
I am also, ma'am.
Shruti and
Himanshu Gupta, ma'am.
Himanshu Gupta. Okay. Where are you working?
Max Hospital, ma'am, New Delhi.
Oh.
Yes, ma'am. As a clinical
Dr.
pharmacist.
Gagan is director for your hospital?
Sorry, ma'am.
Dr. Gagan.
Dr. Garg.
Gagan Srivastava. Cardiac anesthetist.
Uh, I, I don't know, ma'am. Here, Dr. Balbir Singh,
Okay.
cardiologist. Yes, ma'am.
Anesthetist, he's cardiac anesthetist.
Yes, ma'am.
Okay. Someone is also working as a clinical pharmacist. So yes, till now we have discussed very important things. Did you apply in your workplace, in your daily routine? It might be crash cards, whatever the things are. Shruti, Himanshu, what is his name? Sheikh Adnan.
Ma'am, actually, I am a antimicrobial stewardship, ma'am. I'm not
Okay.
involved in any crash card.
But you are working for patients only, no?
Yes, ma'am.
Then you might be checking drug-drug interactions, rational use of antibiotics and irrational use of antibiotics in hospital.
Ma'am, currently, now only I have joined, ma'am. Just,
Okay.
yes, ma'am. I'm doing, only I'm collecting the reserved antibiotic and like antibiogram, that like, ma'am.
Nice, 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 nice. You have prepared antibiotic policy for your hospital?
No, ma'am. Actually, before clinical pharmacists, they have prepared, ma'am, already.
Okay,
Same.
fine. Nice. How about Himanshu?
Yes, ma'am.
What is your role in hospital? Are you applying this audit
Yeah,
thing in your daily routine?
yeah, ma'am. All IP medications, patients order verifications. Okay, like correct dose, correct route, and correct schedules. Okay, and
Okay.
crash card. Like yes, ma'am.
You're
Yeah,
working on this, right?
yes, ma'am.
You're
Online
checking
verifications.
verification and everything.
Yes, ma'am. Drug
Nice.
interactions. Like yes, yes, ma'am.
Hope
And
this session is helping you out.
like ma'am, policy. Okay, and recently I joined hospital. So
Okay.
yes, ma'am.
You are into the patient counseling also?
Uh, no, ma'am. This time I am not.
I think you should start patient counseling also. You have to interact with the patient daily
Yes,
and
ma'am.
that counseling also. And even Shruti, though you are working for antimicrobial stewardship, but still you are supposed to interact with the patient. Whenever you interact with the patient, then you'll come to know many things.
Sure.
uh, yeah, this is our today's session. Can we start our today's session? This is something very important. Yeah, this is actual role only a pharmacist can do in the hospital. Yes, even nurse can counsel the patient, but she cannot be counseling about complete details of the patient. Whereas doctor, they might be counseling about disease and what is the treatment, and the about complete details of the drug and appropriateness of the drug will be always checked by the clinical pharmacist and the pharmacy professional itself. This is something important. See, though patient has been advised right medicine, there should be a proper guidance when to take, how to take, if they miss the dose, and if you observe the patients. And yes, you have been telling you are already into the hospital, and you might be seeing different kind of patients. It might be pediatrics, geriatrics, mentally disordered patients, or bipolar, alcoholic withdrawal syndrome, educated, uneducated. So you have to deal with the people. And yeah, this is most important, where your actual role identifies you. Because if you counsel the patient, they get some kind of if you counsel the patient with empathy, then they get some kind of moral support, and so that they can remember you all the time. And whenever they visit hospital, obviously, undoubtedly, they'll ask your contact for the details, and they'll try to reach you whenever they are into the hospital, or whenever they have doubts in the medication and all. So this is most important, where only a pharma professional can do. This is most important. And yes, this is all about patient counseling and communication skills. Let's see in detail how it is going to be implemented. As per NABH, this is management of medication chapters. These are the chapters: management of medication, seventh chapter and eighth chapter. Seventh chapter is about patients and families are educated about safe medication use. Eighth is about pharmacists participate in patient and family education. These both look similar but different. Here, patients and families are educated about safe medication use. Not only the patient, even the patient attender, it might be the patient, their families, whomever it is, they should know how to use medication safely. And what are the parameters about the safety we are going to discuss. And at the same time, eighth chapter is about pharmacist participates in the patient and family education. So first, seventh one is all about safety in usage, but eighth one is something participation of pharmacist in counseling part. These key aspects are: pharmacist must counsel, document, and ensure patient understanding. So let's see why patient should be counseled. Why pharmacist must counsel the patient. Yes, as I told you, a nurse can only tell that to take medication.
Documentation, meals, books, everything. If I
Pharmacist must counsel, document, and ensure patient understanding. So yes, whenever you are counseling the things, so they may forget, and once they go out of the hospital or out of you, and the medicines they may forget. So documentation is most important, and what are the medications they are using, and how they are supposed to use, and when they are supposed to take the medication. They must document it. And yeah, understanding also. We may say in our own terminology, it might be the medication, it might be a clinical terminology, but we have to know whether patient, to what extent patient understood our counseling. So that is most important. It should not be only a one side where we are counseling the patient. No, that is not actual counseling. We should make a patient to understand about our counseling. That is most important. Let's see what are the roles of pharmacist, and it might be the clinical pharmacist in patient education. Explain indication, dose, frequency and duration. Yes, if you see the yes, we have discussed prescription guidelines that should be written in capital letters and all. Yes, if amoxicillin, paracetamol and pantoprazole is there, then you must tell what is mean by amoxicillin, what is the indication of that amoxicillin. This is an antibiotic. And what is the dose? If you are giving 500 mg, and frequency, most of the patients get confused with the doses, and at the same time frequency also, and most of the doctors prescribe those medications in a tablet or 100011, or else they write bd td od. It might be, see, if you take any atorvastatin, if they should not write any medication as od, that should be written in detail, that is night times after food. And duration for 10 days or 15 days, they should mention in detail. Whenever they mention in detail, so that we can counsel the patient in detail also. And at the same time, we must tell what is the indication. It might be analgesic, it might be antibiotic, what is the purpose of usage, using that medication. If most of the medications were written sos, paracetamol or any ondansetron, anything. So this indication, whenever you counsel the patient about indication of medicine, that will be um registering in their mind, and so that whenever patient takes medication, they'll be aware, I got this infection, this is the antibiotic, I'm using this with the dose of 500 mg twice daily, and the duration 5 days. 5 days, yes, as some people already told, they are working under antimicrobial stewardship. Why it should be used as a course? Why they cannot use for 3 days or 2 days or any randomly, if they feel comfortable from their disease and from their symptoms, they cannot stop medicine like that. We do have certain duration of the medication. Why that is useful? Why patient may getting into the resistant to that medication? So you should detail complete medication usage with their indications, dose, frequency and duration, and clarify side effects and interactions. Yes, this is most important thing is clarify side effects and interactions are very important, where a only pharmacist can understand. In the last session we have discussed drug interactions, food drug interactions. We must know before counseling the patient, we must know what are drug interactions, what are the known food drug interactions. It might be if you remember, that is levofloxacin, all the tetracyclines with dairy products, or else warfarin with vitamin K food. We must tell them, so that that will be used as a precautionary measure to the patient, and it's kind of prevention. And the side effects, few medication has known side effects. It might be any nausea or vomiting, or any, if you observe AKT4, rifampicin, there is a red urine color, and pyrazinamide hyperuricemia, so that you are warning them to take more fluids when you are taking pyrazinamide. And if it is for 15 to 20 days, you must tell that if you feel any like what is it, pains in joints, or any pain, then you must visit doctor. You should tell them what is the detailed side effect of medication and their interactions also. Interactions where we can prevent with the duration. And to prevent all those interactions, you must tell that this antibiotic will interact with the NSAID. So that is the reason you must maintain the gap. So that is the reason, whenever you are clarifying all the side effects and interactions to the patient, it always works as a prevention to the patient. And teach storage and handling, this is also most important. Yes, we have discussed storage. Whenever you are counseling the patient, if you observe, if you don't, can you mute your computers? I request admin to mute all the camera, all the systems, please. Yeah, storage is, if you don't know, if a pharmacist doesn't know about the storage of medication, there is one tip always. There is a label on each and every medication. If medications are supposed to stored in 2 to 8 degrees Celsius, that should be stored in fridge. That is where all the racks of fridge will be there. And if it is minus degrees, that will be polio vaccine, and most of the medication won't be minus. If it is in minus, then those medications should be stored in freezer. And can you please mute yourself? It is a lot of disturbance creating here in the session. Yeah. uh, and whenever those medications are, why storage is very important is to maintain their efficacy and potency of the drug. If you observe, yes, we have discussed these things in detail, but still I wanted to repeat it. If any food products are not stored as per their storage, then it may spoil. That is the reason, as every product has their own nature, and at the same time, even medications also, before they manufacture and before they label it, they do have many testings before launching the product for the storage as well. So that is the reason, to maintain their efficacy and potency of the drug. Always vaccines, not all the vaccines, only a polio vaccine should be stored in minus degree Celsius, that is freezer. Whereas a tubervac and hepatitis B vaccine and all beneath the freezer. If you have a double door or single door, whatever it is beneath the freezer, the next drawer of the freezer is supposed to store in fridge, that is vaccines. And where we cannot maintain our room temperature as 15 or 18 degrees for long, right? So that is the reason those medications which are stored under few medications will be there, should not exceed 15, should not exceed 11 degrees. So in such a way, those medications are more than 2 to 8 and less than room temperature. Yes, we can keep our room temperature 22 or 21, not more than that, that too not for long time. So those kind of medications should be stored under door cooling. And handling, yes, handling is most important. If it is kind of any chemo or any drug which is very important and which is toxic to the pediatric, or few medications kind of antibiotics, then that should be stored in a proper way. And handling, most of the people remove their tablets and they handle in the, they keep in the hand for long time, so it won't work. So you have to tell them how to handle the medication, where our direct skin should not touch with the medicine directly. We have to open and we have to take it immediately. If we store in that in our things, or if it or somewhere else at the room, or somewhere in the layer, or if it is something else, then it may interact with some other things and it loses their efficacy also. And we have something sensitive medication which are supposed to be handled very carefully. And most, if you observe geriatrics, if they fall down also, they'll take those medications which are not supposed to be. So you have to store, you have to teach them how to store and handling. And yes, this is verify understanding is most important in your education. See, you have counseled the patient about their indications, dosage and frequency, duration, and you have clarified side effects, interaction, and food, what are the food you are supposed to take, what are the lifestyle modifications to be followed by the patient. You are mentioning everything, storage and handling. But we never know to what extent patient has understood your counseling or not. So a teach back method, you should apply this method is, whenever you counsel the patient, you should never ask, did you understand, do you understand? No, you should not use those terminology. You should tell them, tell me, can you please tell me the things what you have understood, can you tell me the medication part, what you have understood? That is a teach back method. You are trying to know what they have understood. And if you say, do you understand, they say yes, but we never know they have really understood or not. So always you have to verify their understanding in a teach back method is, please let me know what you have understood about this. So they'll say, I have to take one tablet in the morning, I should not eat this food, that food. So that if any corrections are needed, or else to what extent they are understanding your counseling, you can say that. And if it is not there, if they are not comfortable with your language, you can use some local language. Or if you are not aware of their local language, you can call some other people who translate it in their own language, which where a patient can understand. So that is how it helps us when we verify in the teach back method. We never ask the patient, do you understand, are you okay, are you comfortable? No, never use those terminology. Always tell them, can you please tell me what you have understand. In that way you have to ask. That is, that method is called a teach back method. And this document counseling, yes, whatever you have, this is most important as per NABH. And whatever the uh, norms are there, this is very important. How many patients you have counseled in a day, how many patients, and what are the key factors you are, what are the key parameters and the metrics you are following in your counseling. So that counseling should be documented. In that, although the person who is counseling the patient, at the same time the attender, or it might be the family education, that form is called a family education form. And you should collect their signature also. It might be patient, or it might be their patient attender, but you have to collect their signature also along with the name. If it is patient attender, you have to ask them to write about the relation of the patient. It might be wife or sister, or whatever the relation is, you have to ask them to mention this. That will be evidence at a point. This has come, every NABH norm has not come so vague, but just because of few things and bitter experiences these we got. Actually, few medications were counseled, but patient is not aware of it, and they did not apply this teach back method, and they counseled, and they understood that patient has clear with the medication counseling, but patient has taken wrong medication, and they blamed hospital and the pharmacist itself, that no counseling was given about the medication. That is the reason we took wrong medication, and we paid a lot of amount, but there is no counseling from the pharmacist or the clinical pharmacist about the medication. So that is the reason document always helps to keep patient, at the same time employee safety. I say first employee safety, then patient safety. However, we are dealing with the patients, but this document ensures employee safety. If any legal norms are there, then we can show the document that even a our counseling, our pharmacist and the patient signature, they are acknowledging that they have understood the counseling. So this document is very important in the NABS. That is the reason this is all, document is all about employee safety, then patient safety. Yes, we are here to take care of patient, but if something happens with the patient, yes, you have been seeing the many cases, they are abusing doctors and all the healthcare professionals. They can do only when there is no evidence, and this document is all about the evidence, where we have taken care of the patient in an appropriate way and with the counseling as well. So this is most important. You have to you have to counsel the patient, at the same time document. Let's see what are the conditions and what are the focus we are supposed to be. See, if we are counseling for the chronic conditions, long-term adherence and monitoring, diabetes, hypertension, asthma, psychiatric patient. So insulin handling, if you consider all the chronic is kind of comorbidities itself, right? So if you are considering the diabetes, then you are saying how to how to handle insulin, and what is their storage, and if they open it morning, and what they are supposed to do, and how to handle it, and how they are supposed to monitor their glucose levels. So you are detailing about their condition, and that is first clinical condition. And before clinical condition, you are checking the details, from how many years this patient is into these comorbidities, and he's on diabetic, on what basis you are going to counsel them? You are going to check the details of the patient. Without details of the patient, never go to the patient directly, so that you cannot be reflected as a wrong counsel or something else. So that is the reason, know the details of the patient and the condition of the patient. And in diabetes, you are supposed to tell what is insulin handling and what is the storage and what are the units they must know and how they are supposed to monitor the glucose levels. And whereas hypertension, adherence, lifestyle advice, like whatever the lifestyle yeah, every in everything lifestyle advices will be there. But in hypertension, yes, diet and many things are to be there. And adherence also you are going to discuss. And asthma, if it is something bronchial asthma or COPD or whatever things are there, you are giving inhaler technique demonstration. That is most important. See, every medication will be saying that, but this condition is all about demonstration of inhaler. They should tell that, okay, this person has taught us how to use those equipment, because they are not aware of it, no. And they are layman, and they don't know how to use it. And if something with the excess dosage of inhalers also leads to hypokalemia, where we cannot start potassium chloride from day one, as it is high risk medication. So we have to balance both. You have to tell them in detail how to use those inhaler techniques and what are the doses, or else it is 6th hourly, 8th hourly, whatever the things are, you must tell them. And psychiatric side effects complaints, yes, you cannot teach the psychiatric patient directly, so but still you have to counsel the patient attender about side effects. Most of the psychiatric patients, all the schedule X drugs has more side effects, but still, if we see this risk benefit analysis or whatever the things are, but still we are supposed to use this medication. And they must know, most of the psychiatric patients are, they feel more appetite will be increased and weight gain, many things will be. Then one, what is the complaints in usage of the medication and non complaints, you must tell about the chronic conditions. This is what about the chronic conditions in counseling part. And in counseling, dealing with the elder patients, right? And these people did not counsel. If you see your grandparents or any elder one, any pediatric patients, if you observe, they say this patient has not this pharmacist has not counseled me, I don't know this medication. If you observe your grandparents, they'll ask all the family members, tell me how this medication is supposed to use. So dealing with elder patients is something different. So should be always a pictogram, use large font leaflets and slower pace. This is something important, is it should be always leaflets, it cannot be verbal, because yes, already elder patients cannot remember all the medication. And most of the medication looks alike, and it may leads to confusion also. So whenever you are dealing with elder patients, large font leaflets, if it is with pictogram or something else, that would be more better. And slower pace to be there. And assess vision hearing challenges, yes, as geriatric patients and elder patients don't have much vision, and you should check, you should teach back method. You have to apply this, whether they can see these leaflets appropriately or not. If they are feeling any challenges in hearing your counseling, you should ask them. When these if they are, if you ask them, they say yes, we can understand. But what we can apply is here is only teach back method itself. Now you have to be empathetic to the patient. And whenever you're counseling, I'll tell you in the next slide how, what are the tips to counsel the patient, instead of going directly about the clinical aspects with the patient. And avoid medical jargon is something important. Is, see, if it is hypertension, an elder patient can understand what is hypertension. No, they cannot understand. You must use high BP or low BP. So you must use a layman language. You cannot use medical language because they cannot understand. And hypertension or diabetes, whatever the things are, they cannot understand if you use those medical jargon. So you have to use layman language. Instead of what do you say? Polypharmacy, yeah, check for polypharmacy is there. Can they understand polypharmacy? No, they cannot understand. You must say that you are on many medications, chala, you are taking lot of medications, and still these medications are supposed to be used. So in a layman language you must tell them, if it is hypertension, or else if it is diabetes, or if it is something asthma, always use layman language instead of clinical language or clinical medical terminology. And simplify dosing schedule once twice daily. Yes, they might, most of the doctors might be writing O111 OD BD. No, they cannot understand this language at all, and even all the perceptions might not be the similar. One doctor is might be writing 0 as a tablet, but another doctor is writing 1 as a tablet, so it might be confusion to the patients, first of all healthcare professional itself. So always you have to write them in their local language itself, that it might be once daily or twice daily. And what are the medications are supposed to be taken with food or without food, you must note it down all the things. And check polypharmacy and interactions. Yes, most of the elder patients will be on polypharmacy itself, but still you have, when patient is on polypharmacy, there might be a major chances of drug interactions which are into into severe, and sometimes it may leads to high risk and adverse drug reactions also. So patient, when you are dealing with elder patients, check always interactions, because most of the patients will be a minimum 10 to 15 tablets or polypharmacy with their co-mobs and everything. So these are the tips to be followed in the elderly patients. And yes, I have a small case study in this. Yes, we do have many case studies, but only for this, for the easy understanding. I see Mr. Sharma, 72 years, forgets his BP medication. How can you counsel him effectively? Can anyone tell?
Ma'am, we should counsel the relative of the patient.
Yes. But this patient is okay, he's, or he can understand. But how can you counsel? He forgets, usually forgets his medication. So, firstly, you have to tell what is mean
Ma'am, we
by.
can hand over.
Yes, please. Sorry.
Ma'am, we can hand over a card or something that contains the information about the medication and hand it over.
Very good. Very good. Whenever we are dealing with the elderly patient, always pictogram helps us. And firstly, you have to tell about what is BP, what is hypertension, and so that they'll remember why, whenever your blood pressure increases, what are the side effects, and what are the consequences, complications he might be facing if he forget this medication. You must tell about the side effects and what are the parameters, complications if they miss the medication. But still, you have to counsel about the disease first, and the medication and their usage, and there any lifestyle modifications. And for their easy understanding, you must write in a leaflet, that is in a pictogram. Always it might be very helpful. And any color coding or anything else, or else if any color boxes, you can give that. And yes, apart from those, you can tell to their family or caregivers also. That is also a good idea. And always whenever you use these kind of medications with the uh, geriatrics, a pictogram helps us, because they remember with the colors, or they remember with the any sign you have given instead of directly verbally or something else. So you have to counsel them about the disease, so that whenever you tell about the disease to them, they'll be more careful and they never forget. So you, even we also, if we know about, as we are healthcare professionals and we are aware of the disease, so we are scared and will take medication on time. Whereas layman, they don't know what is severity if they miss their medication, BP medication or whatever the things are. So we must tell them what is actual importance of BP and why it is very useful, what are the complications they may feel if they forget those medications. And always use the effective language, that is local language. And make them comfortable. First of all, make them comfortable, then we can discuss with them, and they'll be hearing you as well. So if they don't, if you don't make them comfortable, then they may not listen, and they seems like listening but it won't. So always carry empathy, and yes, I'll tell you all the end of the session. I'll tell you how we are going to counsel the patient. And this is pediatrics. Counseling pediatric patients, yes, address parents and caregivers primarily, because pediatrics cannot understand what are the things to be followed. So always address patients or caregivers only, and demonstrate dose measurement. Syringe spoon, yes, this is something important. You might be telling 5 ml or 1 ml or 2 ml, but all the parents might not be knowing how to measure it. And at the same time, what are the indications? See, if you see the cup, measuring cup, that will be there from zero. Sometimes that few things will be there from one. They never know. You must tell them what are the dose calculations about the measurement, or else they have to use any two drops. They are supposed to use in a syringe or spoon. You have to demonstrate about the dose measurement also. And warn about flavoring agents and allergies. Yes, most of the medications are will be given with the flavoring agents, because more pediatrics children won't, might not be cooperative for the medication. So flavoring agents will be combined based on the medicines and their mechanisms. You must tell, you must warn them few medications cannot be combined with citric or kind of orange juice. So some different things will be there. You must warn them what are the allergies and flavoring agents. You must warn them. And the storage, yes, all the medicines, basically all the medicines should always keep out of reach of children. That is basic thing. And you, and especially to the parents regarding the pediatric patients, you must tell them. This is most important when you are counseling the pediatric patients. What to do if your child spits out of a dose? Tell me. Tell me. Usually child usually how many people have seen when child is ready to take medication, they never take, right?
Yes, ma'am.
So how will you counsel the parents when they spit the dose? How will you counsel? Do you ask the parents to give one more dose, or else will you give any tips uh, for their parents for avoiding this?
Ma'am will give the tips.
Yeah, what are those?
Ma'am, for example, like if a child likes certain flavor or certain fruit, then we should have it beside the medication and do some fooling around it and try to give the medication.
Very good. See, whenever we are informing the parents to combine with their flavoring agents, you must know about the indications of the drug and their agents also, because see, most of the fruits have a different kind of vitamins and all. So you must check. Being a pharmacist, when you are counseling the patient, parent about those combination along with the juice or something else, you must know what are the details and how can you counsel them. And that is most important. If that is something um, mm, harm we are doing without knowledge, when we are counseling the patient about their combination, you might be telling about the citric or orange juice or apple juice, but they may have some drug interactions, or baby might be allergic to the food or something else. So you must know about the child. That is the reason you must know about the details of the patient and the condition of the patient, and the drug where you are advising, you are counseling the patient, you must know about it. and then itself you have to counsel the parent accordingly on what basis they can mix it with, and what is the dose, and what is the measurement they have to follow. You have to explain the parent. And verbal instructions: use patient's language, short sentences. Yes, is it, do you agree this or not? Whenever patient language is all about layman language, they cannot understand medical terminology. So they have, you must make sure patient is understanding, so that we should always know about the patient comfortable language. Then see, if you see, now I think here most of the people are from different places: Telugu, Hindi, English, your regional language. Always consider your regional language whenever you are dealing with the patient. At the same time, try it whenever you are using the regional language, you must tell in a daily routine language. You cannot, you might be doctor in medicine, but still your expertise in medicine, we cannot use this. What are the complications, consequences, mechanism, these terminologies cannot be understandable by the patient. So whenever you use the language, daily routine language, then they'll be very comfortable and easy understanding. And the short sentences, yes, if whenever we use patients, or dealing with the patient directly, use always a short terminology. When you say complete details of the patient in a complete medical terminology, it may leads to confusion to the patient. So it, they might be missing important information when we use lengthy language. And explain when and how to take. Yes, this is most important, when they are supposed to take and how to take. And reinforce key points, dose, time, precautions. Confirm understanding using teach back. This is the verbal instructions you are going to give it to the patient. Whenever you are counseling the patient, these are the most important, these are the verbal things. And whereas written instructions and labelings, including name, dose, frequency, route, expiry. Yes, whenever you are labeling those, this is the mandatory. Whenever you are giving two medications separately with a small tablet, so you must give a cut strip policy, that is kind of brown cover or any polythene cover. Those medications should be always labeled with their name, dose. See, if you observe, what are the main medications will be similar? Can anyone say? uh, Librium. Yes, Librium tablet is there. If you observe 0.5 mg, all the doses looks very similar, whereas it is very schedule X drug, and we should be very careful in using the dose as well. So when you are giving individual medications, kind of 2, 3, or whenever you are using the cut strip policy, that should be kept in a separate cover, and it should be labeled with the name, dose, frequency, route, expiry also. When we are giving the tablets individually, yes, it is a legal and it is our responsibility to write their expiry, because without that they cannot get trust on us. It might be expiry or something else. So that is the reason we must write all these things on a brown paper or any polythene, that is a cut strip policy where we are using it. And use pictograms where literacy is low. Yes, for all the geriatric patients or whomever it is, always use the pictograms. That will be easy understanding and that registers in mind. If you observe, see, I'll tell you your example. You might be watching movie, and you have seen the picture, and you are conveying the all the story to the patient, your friends. So a friend, does a friend understand, or else they can remember all the story? No, he cannot, because you have seen the visualized things and pictograms from the movie or something else, where you, it can be registered in your brain. So always whenever you see the things, it might be the picture or anything else, that will be registering in the brain. And whenever you are dealing with illiterates, that might be pediatrics or whomever it is, you must use a pictogram how to use those medications. If you are using any milk or anything, glass of water, try to draw a glass of water and with the tablet symbol, so that that will be easy understandable. And always give a separate boxes, Sunday, Monday boxes will be there. Give that to them, or else Most of the hospitals we are preferring those is on the paper cover. We are writing all those morning, afternoon, night, and evening, and we are using all the pictures, so that whenever we give these tablets and we are marking those, and they'll be easy understandable when we use the pictograms. So this is how we can counsel the patient for their easy understanding and to avoid the reactions, and it ensures patient safety as well. And yes, I had told you avoid abbreviations. This is error prone abbreviations. QD, BID, and TD, whatever. These medications should not be used at all. Always use once daily, night times, after food, before food. This is mandatory to be written from the pharmacist, or night times or day times after food, or how much time you have to take gap. That should be mentioned in detail, not in the form of abbreviations. It should be written in a complete form. And for discharge medication, provide written and verbal education. Yes, I think here most of the people are from clinical pharmacies and the pharmacies as well. Discharge, you people have might be counseling the patient during their discharge. So whenever you are writing all those things in a written format, then that will be easy understandable. At the same time, whenever patient got admitted, there are tips to be followed. You never deal with the patient medicine directly. You have to tell them on what complaints they have come to the hospital, what are the course they have taken. It might be analgesic, antibiotics, or FFP transfusion, or anything else. You have to tell them what is the course they have taken, and why they are supposed to use discharge medication. Once they go home, they are getting well and they are going to home, they are going home, but still why they are supposed to use discharge medication is you have to mention them. These are the medications to be used once you go home, which are written orally for complete curing your infection, and it you must tell them. And that should be in a written and the verbal also. Discharge counseling should be both written and verbal, so that patient, if they are in the condition where they are unable to listen for long time and they got vexed and wanted to go home as early as, once they go home, of course they are supposed to take this discharge medication. So if you provide them in a written or something written format, then that will be useful also. At the same time, you should give verbal education to the patient or attender. This is most important for the things. Yes, this is communication. Till now, we have discussed about patient counseling. Yes, I wanted to tell you before this patient counseling, few tips to be followed whenever you go to the patient. See, where, can you trust someone who speak directly to you without addressing themselves? I have come to you. I'm talking something else, but I'm not addressing myself at all. Can you trust me? Can you trust me?
No, ma'am.
No. Yes. You we cannot trust. So whenever we go to the patient, wish them. This is most important things to be followed by the healthcare, not only healthcare, anywhere you work, but a patient counseling gives more attachment, more moral support to the patient and their attender. That is the reason, see, if a patient got hospitalized, many relatives, friends, their close people will come to the hospital. Why? Do they treat the patient? Do they heal their disease? Why do they come to hospital? Tell me, why they have come to hospital to see the patient?
For psychology support, ma'am.
Very good. And it gives strength, moral support. It gives strength. Yes, something happened, but these many people are there. It gives some strength to the patient. If you observe COVID pandemic, most of the people, once sorry, actually got some important call from hospital. Yeah. Yeah, whenever we are dealing with the patient, empathy is most important. Yes, whenever we go to the patient, and yes, many relatives will come just because of moral support. And in the COVID, especially in COVID, most of the people passed away just because of their mental status. It's not about disease or something else, because I have worked with the patients, COVID patients, closely for first wave and second wave. And first wave is there is separate consultation of mind to counsel them and all those things. Whereas second wave, most of the people got hospitalized, and known people got hospitalized just because of their loneliness, and no one can be reachable to them, and they became damn low. And the most of the COVID patients got cardiac arrest, not because of something else or anything. If you observe, pneumonia, yes, it can be treated, but majority are the cardiac arrest, I can say, just because of their mental condition and their situation there, where they were so alone and they were isolated. That isolation is very dangerous to the patient. So this is most important. And if you observe patient in ICU, their attendants may have a limited access, that too only in the visiting hours. But 24 by 7, only the healthcare professionals are dealing with them. So that is the reason we should be so empathetic to them. And whenever you go to the rounds, yes, seeing documentation is important. At the same time, meeting patient is most important. Whenever you talk to the patient, address yourself. That is, first wish them. It might be good morning, good evening, whatever it is. Don't be so mechanical. You are not dealing with the machine. When you're dealing with the machine, it has no emotions. You can deal. If you're so angered, you can beat it. Or else, if your software or your something machine got corrupted, you can update it. Or else you can restore it, or whatever you want, you can do it. But when you're dealing with human life, things are completely different. They do have some emotions, and that impacts their condition. And whenever, especially patient, never treat them as a patient. See, always be empathetic. And don't tell them that this is patient so and so. No, don't speak anything before them about their condition. And whenever you are going to the patient side, address, wish them good morning. Like, if any elder patient are there, speak in local language, and try to tell them, like, whatever, dada dadi, whatever you use, that with the relationship, so that they feel more closer. And they'll be comfortable in your counseling. And after wishing that, you have to address yourself. That is, I'm so and so, like, I'm doctor in medicines. I'm here to counsel about the medication to you. How are you feeling now? Had food? Make them comfortable. Be empathetic. That is most important. If you go to the ICU patient, if you give money or if you offer anything else, they don't want all those things. They just need only a moral support through counseling. You might be knowing about the thing you are doing counseling, but they don't feel it as a counseling. They feel it something they are talking to us, and they have come to see me. So they feel so warmth whenever you are talking with them with empathy. And yeah, it gives some positivity to the patient. That is most important in patient counseling. And whenever you are saying the all these things to them, and you should ask them, how are you feeling now? Did you take medication? Did nurse has given medication to you? Are you feeling comfortable after taking medications? You should ask them, so that whenever you make them comfortable, then they'll be telling you that I'm getting so and so irritation or something else, so that I can you can change this, and I'm feeling uncomfortable with this medicine. So you can rule out with what medication the things are. Is there any drug interactions? What is the time administered this drug? And what is the thing? Is this any ADR? Is this patient is resistant to this medication, or what is this? You can rule out at the back end. So always the things will come in the counseling itself. And the counseling, if you go directly to the patient, take medication, this is for this indication, this is frequency. No, they won't be comfortable, and they are not ready to tell their clinical condition also. So whenever you deal with them, always be empathetic. And make them comfortable in their local language, and um, and make them comfortable before you talk to them, like wish them and let them talk. Let them talk rather than you talking to them directly, and ask few questions. How are you feeling now? Are you okay? Like, had food? Are you having food daily? Are you comfortable with food? Then come to medication part, and are you feeling comfortable in taking these medications, or any symptoms you are getting, let me know, I'll deal with it. You must tell them. Then they'll be saying the things whatever they feel. Then at the back end, you can rule out if there is any drug interactions, AD, or anything else. You can find out. And the next thing is, um, about disease. Never say tell that you got so and so disease, you got hypertension, you got BP, blah blah blah. You never tell all those things directly. You have come to the hospital with these complaints, but you have been treated with all the IV part, and antibiotics, analgesics have given. But if you continue this medication after discharge, then that will be cured completely. Whatever the symptoms will be cured completely. You must use this medication, and you should tell them about the disease, whatever the disease they have, and tell about the medications, like indications, name, dose, frequency, or whatever the routes are, and tell them pharmacological treatment and non-pharmacological treatment and lifestyle modifications. And don't be so vague in telling the lifestyle modifications. I have seen many people that even antiemetics, they say that is antiemetics has the side effects of nausea, vomiting. That is a vague counseling. So before counseling them, and the very basic common terminology will be there, take plenty of fluids. No, how a CKD patient can take plenty of fluids? No, right? So understand the disease. Before going to the patient, read their case sheet, read their prescription, and try to understand. If you are not known to that, then try to know. Without knowledge, never counsel the patient. And after gaining the knowledge about their disease and the comobs and everything, going through their case sheets itself, you are going to counsel the patient. Then they'll be confident on you whenever you are using all these tips. This is the most important thing apart from your regular work, and this cannot be taught to anyone else in the rounds or something. That should be there. This is part of your counseling part. This is not something about the thing where you are supposed to learn separately. Is not that. You are, this is a part of your counseling. Whenever you are counseling with different kind of people, elder patient, pediatric, alcohol withdrawal syndrome, literates, illiterates, many people will be there, and some people will be so egoistic to listen also. Yes, we should know how to counsel all the patients. You can know whenever you are good at their existing condition, and their comobs and everything, and never go to the patient without checking their case. And these are the things you must follow before reaching the patient. You have to wish them and make them comfortable, speak local language, be empathetic. Then coming to the treatment, you take ahead. And this is the tips you must follow for the patient counseling. And these are the written counseling still enough. And this is the communication skills. Yes, effective counseling is when effective counseling is there. Right message, right tone, right time. Yes, right message is all about you are saying what, as I told you, about their disease or whatever the things are. This is most important. Right message, it should be given to the patient, and right tone. You cannot be so vague, you cannot be so loud to the patient, and be empathetic. Whenever you are using the tone, always be empathetic, and the time also. Never go to the patient when they are irritated or frustrated. See the situation of the patient, and always use the things. If they are not okay, tell them that I'm so and so, I'm doctor in medicines, I'm here to counsel here. Are you comfortable to listen now, or else can I come to you later? Then you have to know the situation also. So effective counseling is not about directly informing about the patients, about their treatment or something else. It's all about right message, right tone, right time. And these are the skills, these are the things you must know is active listening. Yes, you always make sure patient is listening to you actively. That is, always maintain eye contact, and if they are nodding head and summarizing, these things are most important to check their active listening. And empathy, yes, you have to tell them, I understand how that feels. This is kind of terminology you are supposed to use. Yes, I do understand it is, this tablet is so bitter, but it is more useful for your existing complaints. You must use these empathetic statements. And clarity, clarity is most important. Simple language, in a layman language, no jargon, is something about no medical terminology. Always use a local language that where a patient can understand easily. Never go with complete medical terminology. And non-verbal cues, that is posture and gestures, yes. You cannot use non-verbal things all the time. Always use pictograms, that might be a postures or gestures, so that they can understand your counseling easily. And barriers to communication, language or cultural gap. Yes, if you observe, language or cultural gap will be there. Noise, time pressure, patient anxiety, lack of privacy. See, these are the major barriers in communication. See, whenever you are dealing with the patients, language or cultural gap, it might be language or something, different kind of people, different kind of culture. This is the major barrier. So whatever it is, you must understand the patient local language or what is their things, and you have to. But still, if you don't know their local language, you must take one translator or someone else, and you should follow those. And noise, time pressure, patient anxiety, these are the most common things. Usually the surroundings will be noisy and more noisy, and the time pressure, the queue might be waiting in your place for your counseling, and there is no time, and there will be a kind of time pressure. You must finish this counseling, so that you have to make clear of that queue. And at the same time, patient anxiety as well. Usually, as I told you, you should make patient comfortable with your wish or whatever the things are there you are supposed to maintain. Then patient may feel comfortable, and he may come out of those anxious moments. And then lack of privacy, yes, this is most important. See, whenever a patient is going to the doctor's cabin, they always likes to be alone, so that they can tell whatever the actual symptoms are. At the same time, counseling also, you must maintain some privacy, because their medications might be in different things, but they might not be liking everyone to listen. That is the reason this lack of privacy also may deviates the patient attention. So these are the, suppose you have to break these barriers. And how to overcome these, yes, I told you, use translators, private counseling areas, check understanding. Use, yes, if the people are from local language, always use translators. And private counseling areas, yes, if you observe, many hospitals are using this, started this is private. They are supposed to um, counsel in a different areas, where they should feel this area is private, no one is there to listen my problem, where I can convey this to this healthcare professional, so that he may give solution. So make sure that should be area should be closed. And check understanding is something about teach back method. Instead of you talking to them, you listen to them to what extent they understand. This is how you can break the barriers. Now we have lot many case studies. Now you are going to deal all the case studies now, because these things you are applying your case study. This is something on the NABH I have given. Firstly is patient discharge after CABG with 6 drugs, reports dizziness post discharge is the scenario. Okay, was counseling documented? These are the basic norms to be checked as per NABH. Yes, I told you document is most important for the employee safety, then patient safety. Were side effects explained? These are the questions. How can pharmacist prevent readmission? If we see in detail, pharmacist is all about educator and communicator. NABH requires documented counseling, tailor counseling by patient type. Communication is listening, empathy, simplicity. Yes, if you observe these things, I wanted to tell this detail, this case study in detail is a patient discharged after CABG with 6 drugs, reports dizziness post discharge. Yes, if this counseling was not documented, is there any evidence of dizziness? No, right?
Yes, ma'am.
Yeah, then they can blame directly to the pharmacist that we have not been counseled and the patient is getting side effect. And were side effects explained? Yes, these are the basic known side effects to be there, which are supposed to be documented. How can pharmacists prevent readmission? Yes, here, if you observe, already patient got discharged with CABG, after CABG with 6 drugs, and patient is reporting dizziness. If he continue the same medication post discharge also, probably with these conditions, it may lead to readmission. How a pharmacist can prevent is a proper counseling. Whenever you counsel the patient about their medication side effects and interactions, then it may prevent for the readmissions. Most of the readmissions will be with the side effects itself. And if any post-op is there, there will be some infections. Yes, even the counseling is lacking, how to maintain surgical site, and how about the dressing, medication, food. These infections also may due to lack of counseling part itself. So a pharmacist can prevent readmission with a proper counseling. Yes, the communication should be whether you have to check whether patient is listening to the counseling, and it should be empathetic and it should be in a simpler language. These are the key takeaways as per NABH and anywhere in the JCA as well. So these are the patient counseling part where we have discussed in brief. Let's see case studies. We have many case studies today. Yeah, we are going with the chronic condition diabetes management. Mr. Ramesh, 55 years old, has type 2 diabetes for 8 years. He visits monthly for refills, but his HbA1c remains 9%, and he admits he often forgets doses and skip meals. Have you understood the scenario? What are the possible reasons for poor glycemic control?
Patient is on not adherence, ma'am. Medication adherence.
Okay. Next.
Also, because the patient is skipping meals, so the glucose levels may they may go down, and because of no medication, it may even further go down.
Yes. How should the pharmacist counsel him then?
He or she must explain about the disease first, why taking the medication is important, and how the medication will affect the disease, what are the advantages of the
Okay.
of taking the medicines, and if possible, they can also give him like diet counseling as well.
Okay. Next.
And we have to tell about the side effect of diabetic medication, ma'am.
Very good.
Because due to some side effects, some patient will not take medication, ma'am.
Okay. If you see last line, see, let's go to the scenario once again. 55 years old, has type 2 diabetes for 8 years. He visits monthly for refills, but his HbA1c remains 9 itself. Okay, more than 9. He admits he often forgets doses and skip meals. What is lacking here?
He doesn't know when to take the medication, like after food, before food.
Yes. So you must tell him that he often forgets doses. So as someone told, it's yes, good, appreciate it. You have to tell them what is the side effects of the medicine if you forget the dose or else if you take overdose. So you have to tell them about the diabetes first and the treatment at the same time diet. He himself is admitting, right? He often forgets doses and skip meals. So that might not be uh, the major thing, but still, counseling is missing here is this patient might not be knowing about actual condition of the disease, at the same time the importance of their doses and meals, like whatever the food he is supposed to take. This is something important. See, there is a structured way about the disease, importance of medication, and at the same time the food, how food is impacting their disease. That is lifestyle modifications we have discussed no in the counseling. So this is what a counseling should include, these three parts. So whenever he knew about their disease and about the medication importance, then he never forget to take the doses. As he is not aware of the disease, what is diabetes and how much, if what is the condition, if HbA1c is more than 9, he never know. If he know, then he'll be cautious about his health. Then he must know about the condition, what is the condition and what is the importance of insulin, how it works on him, and at the same time food as well. So whenever these three things were briefed in detail, so that he'll be cautious in his medication, at the same time food management also. This is how pharmacists should explain what NABH management of medication expects apply here, expectations must apply here.
We must address the patient by name. We must show empathy. We must explain about the disease. Uh, what are the what are the then about the medication advantages, and what are the indications, what are the doses, frequency, side effects. We have to check whether there are any drug interactions. We must thoroughly study the patient's case before
Okay.
counseling the patient.
What is the expectation here? Fantastic, you told everything, but a basic expectation to be applied.
Documentation.
Very good. What kind of documentation?
Documentation of the counseling.
Yes, the family education form, whatever the counseling education form, that should be documented, and the signature from the attender and from patient should be taken. At the same time, the leaflets, whatever the leaflets and the pictogram should be submitted. So whatever we have educated, all those points, not exactly detailed points, about summary, it should be there in the document, and that should be acknowledged by both pharmacist, at the same time patient or attendant. Yeah, this is the possible reasons: non-adherence, lack of understanding, poor lifestyle control. If you observe this, yes or no, this case study,
Yes.
counseling focus, explain importance of regular dosing and the diet balancing, Demonstrate insulin and storage if applicable. Yes, ease on insulin, we must. And encourage self monitoring of blood glucose. So whenever he know about their glucose levels, then he'll be more conscious in the doses at the same time food also. Simplify regimen like once daily or twice daily. Yes, this NABH is expecting the patient record and record counseling to be in a like kind of documentation itself. It might be electronic, it might be the documentation, whatever it is. Documentation is expecting from the not only NABH, that is a common practice. It should be mandate and it became mandate now. If we go to the case study 2, elderly patient is on polypharmacy. 72 years, takes 8 different medicines for BP, diabetes, arthritis, and thyroid. She says, I get confused and sometimes skip a few tablets. What challenges do elderly patients face in medication adherence? What counseling tools can help? How to ensure compliance as per NABH standards?
Ma'am, forgetfulness is one reason.
Very good. Challenges,
We
she might
can
be confused, right? So what counseling tools can help her?
we can use pictograms. We can give
Very good.
leaflets.
Very good. What how to ensure compliance as per the standards?
Complaints. We can use the like, as we told, we can use the tools. Plus, we can use some like the medication boxes.
Yes. See, these are the challenges. Poor vision. Yes, as we have discussed, a elderly patient, they might be having same. They might be thinking all the medication might be similar, color or something else, and memory loss, complex schedule also. So, how the clinical approach should be is a large print labels and the pictograms, and medication time chart. Usually pill box color coded pill, as I told you, Sunday, Monday, all the things with the local language. We have some pill box with color coding, so that whenever we use color coding, that will be registered in their brains. And in the elderly patient especially, apart from the patients, always involve caregivers. That is most important. If most actually I think last week, it's been many years I did not go to the patient side, and I was supposed to counsel a patient. Then when I went to the patient, I don't know, he's something he has some laws in something, he's deaf, I guess. He's also, I guess, I'm not sure, but still he's speaking something. Then I figured out, no, he cannot understand my counseling. Then I called their patient attenders. When we were counseling about their condition to their patient attenders, he was saying, are you listening? Like, he's checking their family members whether they are listening properly or not. Yes, elderly patients, we cannot deal with them in all the conditions as same. So always involve caregivers so that they will be understanding and they'll be more careful in the counseling part. And whenever these patient attenders are involved, then they'll write all the things and they can guide them at the house in what way they can understand easily. And we always use the color coding, so that that color coding always impact days and the difference between the medication as well, so that they'll be avoiding the missed doses. And here pharmacist involvement is about the patient education. It's all about the documentation for the counseling also. Yes, I told you, family education form, that is most important, because elderly patient can change words at any time. But whenever you are taking the signature from the caregiver, that will be always evidence in the future also. If they feel any consequences or any side effects also, they, though they come to hospital, we can show this family education form. Yes, this is the your relative and he's your close person, your family member, we have counseled him, you also, and he acknowledged it. We can show that document. So this document always ensure our employees safety, apart from the patient safety, employees safety, I can say this. And a pediatric patient, this is a parental counseling. A 3 years old child is prescribed an antibiotic syrup. Mother says he spits it out because it tastes bad. Yes, everywhere it is in the, this is the universal fact. So what counseling point should be the pharmacist emphasize here? And what safety advice should be given to the caregiver? And what documentation is needed under NABH? No, that is management of medication. Tell me.
Pharmacists should emphasize on the dose, especially the dose, and usage of techniques, cooling techniques to the pediatric patient. And as well, the pharmacist can suggest a flavored medication possible. Safety advice, the pharmacist should tell the parents to keep the drug away from the child, and the documentation is a counseling documentation.
Very good. Fantastic. Explain correct measuring techniques. Yes. And whatever they are supposed to use, you are saying what measuring techniques are supposed to be used by the parent. If they don't use any specific measurement, it may lead to sometimes overdose also. So always a proper measurement should be there when we are dealing with the pediatrics. And yes, flavor mixing with doctor's consent only. We should never go on our own whenever we are using all the flavor mixing. You should always take a consent from that, because we never know what are the interactions with their flavors will be there. And continue full antibiotic course. Yes, you must tell them why antibiotic is very important, why this course is much safe to the baby. And safety advice is, yes, you have told. And storage also, as per label, refrigerator or whatever it is. Record is always a parental education here. It should be in a pediatric things. Caregiver acknowledgement, yes, caregiver might be, they might be writing their caregiver or parent, but they have to write their name and the relation. That is most important in family education form. That is most important to show their acknowledgement. And after that you are going to file it. And yeah, this is discharge counseling. Post surgery, 60 years, male patient, discharged after CABG, that is bypass surgery, prescribed 6 medications, including antiplatelets, statins, beta blockers. After 5 days, he reports dizziness and confusion about the medication time. What counseling was likely missed at discharge? How can pharmacists improve understanding post discharge? How NABH clauses apply?
The timing of the medication, when should be taken, the pharmacist should counsel about that.
Yes, very good.
And pharmacists must emphasize on side effects of the medication.
Very good. What counseling was likely missed at discharge? How can pharmacists improve understanding post discharge?
Post discharge, we can improve the counseling by giving the leaflet, by giving leaflet informations.
Post discharge should be always verbal and document, that can be
Documented.
leaflet or anything else, right? Here, what might be the missed part? I say medical terms. including this is, see, you have used antiplatelets. Instead of antiplatelets, you must have used blood thinner, right?
Yes, ma'am.
Statins, it might not be counseled the proper timing. It might be written OD instead of night times. Beta blockers, right? And how a pharmacist can improve this? See, missed counseling is medication timings and interactions. Side effect, dizziness due to beta blocker. Will you agree?
Yes, ma'am.
Yes, ma'am.
What is the interaction in it? We have discussed this example in drug-drug interactions. This might not be example, but we have discussed in some other thing. Tell me. Antiplatelets, beta blockers are the major drug-drug interaction here. Will you agree?
Yes.
This is the reason. So timings were not detailed to the patient and interactions were not counseled. So whenever patient was not counseled about their appropriate timings and the interactions, then this beta blocker, just because of the interaction with the beta blocker, dizziness is the result. So conduct post-discharge counseling call. This is corrective action. That is always a post-discharge is not done detail and use, yes, someone told about the medication card. Discharge medication card along with the timings and indications which are supposed to be in a verbal, at the same time the document as well. And the discharge process includes medication education and the copy of discharge counseling sheet retained in file. So whenever OP is something different, but discharge, they must know about this, and along with the discharge summary, they have to give a discharge counseling copy. This is most important. So without this, patient may get confused. As and one more thing is, at this, apart from the patient, even attender should be also uh, counseled regarding this. Whenever they counsel both, uh, then a proper documentation should be taken, that is kind of acknowledgement of patient counseling part, whether he understood or not. In that, what counselings were missed here is timings, interactions, which are most important from our end, and the drug-drug interactions, because CABG is something where all the emergency and high-risk drugs are used, and you have to be more cautious when you are dealing with the bypass surgery. So this is the condition we, being a pharmacist, should follow. At the same time, caregivers are also supposed to be counseled, and acknowledgement is mandatory. Apart from that, you should provide the discharge counseling form, so that whenever they get doubt, they can open that file and they can see. Apart from their summary, this counseling sheet is supposed to be there. This is about the communication breakdown. A pharmacist quickly explain medications to a patient using medical terms. The patient nods but later takes double doses of two drugs. Identify the communication errors. How can active listening and clarity prevent this? And what are the NABH expectations regarding communication?
The pharmacist should explain about the medication in detail and not in a hurry, so that the patient would understand when to take, how to take the medication.
Yes, what is the error here? What is the
Usage
communication
of
error?
Medical
medical
term.
terms instead of layman language.
Very good. Next,
After giving the advice, we should cross-check whether the patient understood
Next
about
error.
the disease and
Next error.
medications.
So patient was not counseled about their mechanisms, that is a therapeutic things about their medications in the local language. So whenever they were not counseled about the medication in detail, so they are not aware of the medications and at the same time their usage as well. So whenever you are counseling the patient, counseling patient in the layman language, that is routine language with a easy and simpler way, and you have to tell the importance of medication. When you tell the importance of those medications, then double doses may can be prevented, but as this importance is not known to the patient, so the patient has taken double doses. And how can active listening and clarity prevent this? I told you one method. I told you one method.
Teach back method, ma'am.
Very good. And how a clarity that, say, whenever you are using this teach back method, so that you can understand to what extent patient understood your counseling, right? So this teach back method is always prevents these complete doses, overdose, or whatever the things are. And how can you understand the patient is listening actively?
By seeing, making eye contact,
Very good, very good. So these
and
are
if
the
the
tips.
patient not
Very good. What are NABH expectations, yes, regarding communication?
in the local language, if we speak, it is better.
Yes. If any local, if you are not aware of local language, then you must call any
Translate.
translator. So this is most important. So here the reason might be overuse of jargon, no confirmation of understanding. These are the main reasons of overdose. And the corrective strategy is, yes, we have discussed here, simple language, kind of blood thinner. Yes, I told you, I guess blood thinner instead of antiplatelet. Teach back method can always prevent how can you repeat how you'll take this medicine. You should ask the patient in this way. And maintain, yes, we have to check the patient whether they are listening or not, right? So maintain eye contact and empathy, and ensure understanding of the medication instruction is, you can work under only a teach back method. So this is all about today's session about the patient counseling, which is most important. Hope you understood. If you have any doubts, please ask. Any doubts? Guys, tomorrow is the last session of our course, and tomorrow we are discussing all about the KPIs and what are the indicators we are supposed to, and we are going to check all the details. But I want one more thing, one more session for the mock audit. That is purely interactive session, and come prepared for that session, and we'll see, we'll make a mock audit. How you are, if you are an ABH auditor, how will you act, and what are the things you'll be going to check in the hospital. And if you are an NABH auditor, how will you act in the hospital? To what extent you are going to check the compliance and non-compliance to the patient side, to the medicine, to the people, to the employees. So as majority of the people told at the same time, Saturday 7 o'clock, yes, we'll be having a mock audit of the session on next Saturday 7 o'clock. But tomorrow is some other KPIs we are going to discuss. I think tomorrow is the last session. I hope you are clear with today's session. If you have any
Yes.
doubts, please.
Excuse me, ma'am, I have a doubt. If
Yes,
there
please.
is a patient, if there is a patient and he or she is not willing to means he's not in the state for counseling and he does not want to get the counseling and he's irritated. So what should we do in that case?
He is not ready to attend counseling, right? Or medication.
Counseling, ma'am.
Yes, if patient is not ready to listen your counseling, always involve family members is first thing. If family members are not available, provide him a leaflet. Okay, first thing, if he is not ready to listen at a current situation, then provide him a leaflet. And if patient caregivers or any attender is not available itself, and apart from this, you can take their contact number for follow up and you can try to reach the patient, and if patient is comfortable, then you can ask your hospital members to connect with you for the counseling, so that you can document it as a telephonic counseling was done to the patient by me as patient was irritated during discharge. You can mention this.
Okay, thank you, ma'am.
Yeah. Any doubts? Try to
No, ma'am.
open your videos at least tomorrow. However, this is the last session tomorrow. No, I just wanted to see you guys. I appreciate the people who are attending the session, because this is something apart from your academics and which is a value added for your uh, work thing. I can say whenever you are getting into the workplace with the proper norms and terms and conditions, obviously you'll be more valued. And when you are aware of these NABH norms, yes, this is everywhere in the India, that is a national accreditation board for hospital. In future, without this NABH, no hospital is going to run, because all the insurance companies are going to check only with the reference of NABH. They are going to collaborate with the hospitals. So this is a quality check. In fact, though NABH norms are being maintained, but still there will be a separate audit from the insurance companies. But still, they are not going to opt it. If you observe many top insurance companies, they never collaborate with non-NABH hospitals, because there is no evidence of safety. So documentation always means a lot, and they are supposed to send all the documents to NABH, that is Quality Council of India, once in 3 months, or some data are supposed to be sent monthly once. So this is something related to the quality. And yeah, this is if you are leading this and if you are gaining this knowledge, I'm pretty sure you can be more eligible to the wherever it is NABH audit or anything else. You can be the key person. So firstly, I appreciate the people who are trying to um attend these sessions. And yes, I'm looking forward for the last mock audit. I think you are the people who are going to interact. Yeah, thanks for your response that you are going to on your cameras tomorrow. Fine, see you guys tomorrow. Bye bye.
Thank you, ma'am.
Thank you, ma'am.
Thank you. Bye.